Hello everyone, welcome to PharmaGrid. So let's continue with the remaining questions. Question number 21. All of the following statements about plasma protein binding of a drug are true except which one? Options are displacement of a drug from plasma protein binding sites results in a transient increased volume of distribution. Then displacement of a drug from plasma protein binding sites makes more free drug available for glomerular filtration. Next option is displacement of a potent drug that is normally 95% bound may cause toxicity. Albumin is a major protein involved in protein binding of drugs. And the last option is drugs that are highly bound to plasma proteins generally have a greater volume of distribution compared with the drugs that are highly bound to tissue proteins. Okay, so in the question they have asked us to find out the wrong statement regarding the plasma protein binding. So here the correct answer is option E, which is the wrong statement regarding plasma protein binding. Drugs that are highly bound to plasma proteins diffuse poorly into the tissue and have a low apparent volume of distribution. Next question. The onset time for a drug given orally is the time for the drug to. The options are reach the peak plasma drug concentration, reach the minimum effective concentration, reach the minimum toxic concentration, begin to be eliminated from the body, begin to be absorbed from the small intestine. So here the correct answer is option B, that is onset time for a drug given orally is the time for the drug to reach the minimum effective concentration. So the onset time is the time from administration of the drug to the time when absorbed drug reaches the minimum effective concentration. The MEC is the drug concentration in the plasma that is proportional but not necessarily equal to the minimum drug concentration at the receptor site that elicits a pharmacologic response. Next question. The initial distribution of a drug into tissue is determined chiefly by the options are rate of blood flow to the tissue, glomerular filtration rate, stomach emptying time, affinity of the drug for the tissue, plasma protein binding of the drug. Here the correct answer is option A, that is rate of blood flow to the tissue. The initial distribution of a drug is chiefly determined by the blood flow, whereas the affinity of the drug for the tissue determines whether the drug concentrates at that site. The glomerular filtration rate affects the renal clearance of a drug, not its initial distribution. The gastric emptying time and the degree of plasma protein binding affect the drug distribution but are less important than the rate of blood flow to the tissue. Which tissue has the greatest capacity to biotransform drugs? The options are brain, kidney, liver, lung and skin. Here the correct answer is option C, that is liver. The kidney, lung, skin and intestine all have some capacity to biotransform or metabolize drugs, but the brain has little capacity for the drug metabolism. The liver has the highest capacity for drug metabolism. Question number 25. To determine the absolute bioavailability of a drug given as an oral extended release tablet, the bioavailability of the drug must be compared to the bioavailability of the drug from. The options are an immediate release oral tablet containing the same amount of active ingredient, an oral solution of the drug in the same dose, a parenteral solution of the drug given by intravenous bolus or intravenous infusion, a reference extended release tablet that is a pharmaceutical equivalent, an immediate release hard gelatin capsule containing the same amount of active drug and lactose. Here the correct answer is option C, that is a parenteral solution of the drug given by IV bolus or IV infusion. After an IV bolus injection or IV infusion, the entire dose is directly absorbed into the body. The ratio of the AUC of the drug given orally to the AUC of the drug given by intravenous injection is used to obtain the absolute bioavailability of the drug. Next question. Which of the following statements concerning drug metabolism is true? The options are generally a single metabolite is excreted for each drug administered. Often, a drug may undergo a phase 2 reaction followed by a phase 1 reaction. Drug metabolizing enzymes are found only in the liver. All metabolites are less active pharmacologically than their parent drugs. And the last option is phase 1 metabolites more likely are able to cross cellular membranes than phase 2 metabolites. So in the question, we need to find out the true statement regarding the drug metabolism. So here the correct answer is option E, that is phase 1 metabolites are more likely able to cross the cellular membranes than phase 2 metabolites. Remaining all other statements are wrong. So regarding the metabolism, Phase 1 metabolites are often somewhat more polar than their parents. With the exception of acetylated and methylated metabolites, phase 2 metabolites are much more polar than their parents. Thus, phase 1 metabolites are more likely to retain some lipid solubility and are more likely to cross the cellular membranes. It is unusual for a single metabolite to be excreted for a given drug. Most drugs yield a mixture of metabolites. Because of the high polarity and the subsequent high excretion of phase 2 metabolites, they are not likely to undergo further metabolism. Then phase 1 metabolites on the other hand are less polar and are very likely to undergo further phase 2 metabolic reactions. Whereas the major site of metabolism is the liver, there are many extrahepatic sites that secrete drug metabolizing enzymes. Although many metabolites are less pharmacologically active than their parents, there are many drugs whose metabolites have equal or greater pharmacological activity and sometimes greater toxicity as well. Then the concept of prodrugs. Prodrugs means drugs as such is inactive in the form administered. Always form at least one active metabolite. Okay, so I hope now you understand why in the previous question the last option is true and whereas the remaining statements are wrong. Next question. Sulfasalazine is a prodrug that is activated in the intestine by bacterial enzymes. The enzyme most likely responsible is. The options are azoreductase, pseudocholinesterase, N-acetyltransferase, glucuronidase, methyl transferase. Here the correct answer is option A, that is azoreductase. The sulfasalazine has both anti-inflammatory and antibacterial activity when converted to aminosalicylic acid and sulfapyridine in the body. This reaction occurs by reductive cleavage of the azo linkage contained in the sulfasalazine molecule, and it is catalyzed in the intestine by the bacterial azoreductase enzyme. This is a form of site-specific delivery because the intact drug is not absorbed from the stomach or upper intestine and reaches the colon where it is metabolized. Sulfasalazine is one of a few drugs that are effective for the treatment of ulcerative colitis. Question number 28. Chloramphenicol is considered to be toxic in infants. This chloramphenicol is responsible for causing gray baby syndrome in infants. So this problem is due to tissue accumulation of unchanged chloramphenicol resulting from an immature metabolic pathway. Which of the following enzymes would most likely be deficient? The options are pseudocholinesterase, glucuronidase transferase, N-acetyltransferase, azoreductase, methyl transferase. Here the correct answer is option B, that is glucuronidase transferase. The chloramphenicol molecule contains an aromatic nucleus which would be subject to hydroxylation, a nitro group that is subject to reduction, an amide group that is subject to liver hydrolysis, and alcohol groups that are subject to glucuronidation. Of all the enzyme systems responsible for these reactions, the system responsible for glucuronidation is developed poorly in premature infants and infants up to approximately 6 to 8 weeks of age. Okay, so due to the deficiency of this glucuronidase transferase enzyme, this chloramphenicol causes gray baby syndrome in infants. Which of the following therapeutic advantages cannot be obtained by the use of prodrugs? The options are oral absorption, water solubility, duration of action, potency, palatability. Here, the correct answer is option D, that is potency. By definition, prodrugs are inactive or very weakly active molecules that require in vivo activation to convert to the parent molecule. Thus, conversion of a drug molecule to a prodrug does not increase potency because the original molecule with whatever potency it contains is produced after administration. A variety of advantages including increased water solubility, duration of action, oral absorption and palatability can be obtained through the use of prodrugs, but none of these advantages results in an increase in potency of the parent molecule. Question number 30. Which of the following routes of administration would be subject to first pass metabolism in the liver? The options are intravenous, inhalation, sublingual, intramuscular, oral. Here the correct answer is option E, that is oral route. First pass metabolism means it occurs in the liver. First pass metabolism refers to biotransformation of a xenobiotic or drug after absorption from the gastrointestinal tract before it reaches the systemic circulation. Orally administered drugs that are absorbed from the gastrointestinal tract enter the portal circulation and pass through the liver where they are metabolized. Routes of administration that bypass the first pass metabolism in the liver include intravenous, intramuscular, sublingual, buccal, rectal and inhalational routes. These routes of administration allow for absorption either outside of the gastrointestinal tract or in the regions of the gastrointestinal tract that are not part of the portal circulation. Okay, so we have completed today's question discussion series. If you find my channel useful, please like, subscribe and share to your friends. Thank you everyone. Thank you. Have a good day.